Hey, it's been a while since I've been on here, at least talking about my nurse practitioner journey. So today is September 5th, 2024. I have officially been working as a nurse practitioner for a full year. Yep, today makes one full year since I've been working as. So yeah, today makes one full year that I've been working as a women's health nurse practitioner. I'm still at my same job. And I still 100% believe I made the right decision in waiting and accepting this job. So I was coming on here regularly, I think every week, then every 2 weeks, then monthly, and just updating you guys on how the transition was going from labor and delivery nurse to nurse practitioner. And then I felt like it was becoming a little bit redundant because I was doing the same things. But I'm on here to discuss my year in review. I'm actually getting ready to go to work in a few minutes, in about 10-15 minutes, actually. Got to put my daughter on the bus and then I'll be heading to work, which that in itself is a testimony. Well, it's one of the good things, I guess, about working now in an office. Working in the hospital as a labor and delivery nurse, I would not have been able to still be sitting here waiting for my daughter to get on the bus. But anyways, so I will be leaving for work in a few minutes, and I think I'll take you guys along with me and share as much as I can during the day. So as a women's health nurse practitioner, the main things that we do are well woman exams, which include pap smears, breast exams, STD or STI testing, birth control consultations. As far as birth control, I'm putting in IUDs, I'm putting in and removing Nexplanons, which is the implant that goes in the arm. And then, discussing and prescribing birth control pills, patches, non-hormonal as well as hormonal contraceptives. And also we use particular birth control pills for our postpartum moms who are still breastfeeding. Speaking of postpartum, as a women's health nurse practitioner, I also see a lot of OB patients. I do a lot of prenatal care. So as the labor and delivery nurse, I would get the patient on the day or night before of delivery. As a nurse practitioner, I get to see them from beginning to the end. So I don't necessarily get to see them in the delivery process anymore. So I see them from first trimester all the way up until, and then I see them again for postpartum. So I really do end up, creating bonds with these patients. And then specifically because I also see a lot of fertility patients, I really get to see these patients the before stages. I have a lot of fertility patients who we're trying to help them get pregnant. Sometimes we just use medication. Sometimes we just do timed intercourse, make sure they're ovulating when they're supposed to and producing mature follicles. Sometimes we do IUI procedures, which I'll talk more about that later. Let's see. So I do a lot of fertility. I do a lot of the hormone patients in general. And hormone is such a wide span. Menopause patients who are just dealing with decreased estrogen, decreased testosterone, meaning for all of my 40 plus, symptoms can start that early, who have night sweats, hot flashes, vaginal dryness, some differences in their emotional stability. I get a lot of those patients, and typically those are due to menopause. I do go a little bit deeper, and some patients are not in menopause, not in perimenopause, but we have so many different hormones in the body, and they can affect so many different things. Hormones can affect our periods, they can affect our emotional stability, they can affect our hair if it's really dry or if it's thinning and falling out. They can affect our activity level, our desire to even get up and work out. They can affect our inability to lose or gain weight, and then also it can affect our libido. So I also do full comprehensive hormonal panels on patients, and So I guess about maybe 75 to 80% of the patients that I see have to do with hormones, whether that's hormones in fertility, hormones in menopause, or just hormones in, oh my goodness, what's going on with me. I also do a whole bunch of prenatal care. Um, the best feeling is having a patient who was a fertility patient of mine now message me and tell me I'm pregnant, and they become a prenatal or OB patient of mine. Um, I also do a lot of well woman exams, a lot of pap smears. I mean, with the new guidelines, though, with you not having to have a pap smear every year as long as they've been normal, I don't do that many anymore, but there's still some patients who, I would say millennials or older, like my age, grew up born in the 80s or older, we're used to getting pap smears. And so I do have some who are like, no, I still want mine every year. And then I have some who are like, I don't have to get one. I don't want one. So you just never know. I don't assume. I always go in and explain the guidelines and then make it your choice. And then let you know insurance may or may not cover it, but it's still your choice. Occasionally, I will get patients who come in for STD testing. Um, they'll come in for vaginal irritation that can end up being just something simple like bacterial vaginosis, or it can end up being their initial herpes outbreak. I've seen a lot of things in this past year. As far as procedures, I'm doing endometrial biopsies. I'm about to get ready to learn how to do colposcopies. I'm doing hormone replacement therapy. The procedure, particularly for that, would be pellet insertions. Um, I do a lot of hormone replacement therapy. I am not anti hormone replacement therapy. I do also, though, offer both hormonal and non hormonal options. I'm not either for or against. I'm really just for whatever works best for you and quality of life. Um, but yeah, that's all I can think of right now. It's about that time for me to go outside and get my daughter ready for the bus. I will bring you guys along with me and hopefully be able to share some of what I'm doing today. I do not think today is a particularly busy day. If you remember my videos from when I first started, I think my first day I probably had like 6 patients when I was on my own. And then we got consistent to where I was having like 10 to 12. And I thought that was pretty tough trying to manage that and all the charting and the labs and all that stuff. Now I am seeing like 22 patients. That's a lot. On a good day, I might have 17. Today, I don't even think I have 17. So hopefully I'll be able to talk about the day and just about things that are going on. But besides patient care, we do also have labs that we're constantly reviewing. So when you come in and you see your provider, we're doing lab work. We get the results. We need to go through them and call you if necessary. Also, telephone encounters. I have patients who call and leave messages. I have patients who use the portal and just text a message. I have to go through and acknowledge, read, and respond. And just have a little grace for your providers when it comes to that, because on days where I have 22, 23, 24 patients, and a lot of my patients require a lot, I got to fit in those responding to messages and reading labs in between patients. And just remember, when you saw me a few days ago, I gave you ample time, all the time you needed. The same thing I do for the next patient. And so therefore, I may not be able to respond right away or read the labs as soon as they come in because I'm doing patient care, but I do try my best to respond by the end of the day, or definitely by the end of the second day. So have a little grace. I'm learning to have grace for my healthcare providers, and I'm also learning time management. So, but yeah, let's go. Today I'm working in Katy. I work at 2 offices. Today I'm working in Katy. So yeah, which is not that far from my house. about to get my kid on the bus, and then I will see you guys again in the office. All right, so I am in the office, in the coffee room right now, getting me a cup of coffee. First thing I did when I got here was answer my labs and answer my telephone encounters. Now my first patient is here. Now my first patient is getting checked in. It's a hormone consultation. I'm making my coffee, and then I will go and see my patient. So far, I've seen 2 hormonal patients. Both menopause, discussed hormone replacement therapy and also non-hormonal options. I believe both of these patients, though, will be doing hormone replacement therapy. And then I just finished seeing a patient who's having a miscarriage. So I do get some of those appointments that are not so fun. And hers, they're all difficult, right? Hers was a little bit more difficult for other reasons. But yeah. So as I was saying earlier, I see a lot of hormonal and fertility or pregnancy patients, and so far that's all I've seen. But yeah, this last patient was a little hard, and so. But I do have other patients who are here for many other reasons, and so I have to internally pick myself back up and be there for them. So I mean, it's what time is it? It's 10 o'clock. I've been here for an hour. Like I said, today's not so busy, so I've only seen 3, but they were all 3 in-depth appointments. The menopause consultations, as well as this ultrasound patient who is having a miscarriage, and so of course we have to take extra time with her. But that's how my morning's going. I just came back from my lunch break. Yeah, this afternoon is a lot busier, a lot more packed than my morning was. I think I have a patient every 15 minutes, and so far my first patient is late, which sometimes can cause everybody else to get seen late. But hey, it is 1:40. Afternoon clinic starts at 1:30. I think my last patient is scheduled at 4. So we'll see what time I actually get out of here, because sometimes patients show up late, and then if you're allowed 15-20 minutes depending on the patient, sometimes 30, but they show up late. Sometimes it takes longer, so I don't necessarily get out of here at 4 or even 4:15. So, but yeah, starting the second half of the day. First half of the day went really well. All of my patients came. Oh, I did have a patient come. She came for vaginal irritation. And when I did an exam, it looked more like STI lesions. So we had to have that conversation. She had been abstinent and then met somebody and had sexual relations, and now could possibly have an STD. Yeah, all of that goes with women's health care. So yeah, overall morning went really well. I was able to catch up on all of my diagnostic exams. I have to review mammograms as they come in. I have to review semen analysis reports. I had to review some bone densities. I answered all of my labs. I responded to all of my messages, sent out all of my refill requests, and then I went to lunch. And now I'm back to finish the second half of my day. It is 4:36. So I actually did get out at a pretty decent time. So when I first came back from lunch, my first 1 or 2 patients were late, but then my 4 o'clock actually ended up coming early, so it all kind of evened out. And I got out at a pretty decent time. So now I'm on my way home to be a mom. But anyways, second half of the day went really well. I saw a postpartum patient who is one of the ones that I kind of have a liking or a bond with. I've seen her throughout the whole pregnancy. Majority of her prenatal appointments were with me, even though she knew I was not going to be the one to deliver her baby. But yeah, so today she brought in her baby, so I got to meet her cute little baby today. Let's see, I had a couple of well woman exams. I had a Nexplanon removal. For anybody who's ever had a Nexplanon or who's a provider, you know, putting it in is a lot easier than taking it out. And taking it out can be a little bit harder depending on who put it in, if they put it in too deep, and also if you've gained a lot of weight since the time that it's been in, because as you gain weight, the adipose tissue forms around the rod of the Nexplanon, making it harder to fish out. So I had a Nexplanon removal, a couple of well womans, the postpartum. What else do I have? I don't know. I had quite a bit of, I had more patients in the afternoon than I did in the morning, but we still got out at a good time. It's raining here, so I'm driving through the rain if you hear the windshield wipers. But yeah, today was my 1 year anniversary of me being a women's health nurse practitioner. So I was able to bring my phone and do some recordings throughout the day, just kind of update you and let you know kind of how my day goes. Like I said, today was a light day for me. I wish a lot of days were like this. Today was, let me put it in perspective for you. Today was a full day, right? And Fridays, which is tomorrow, are not a half day, but we get out a few hours earlier. And I actually had the same amount of patients today that I will have tomorrow in a short day. So that should kind of put in perspective of how light of a day today was. But it was a good day. I am out of there on the way home, and I will be back to work tomorrow. But that's pretty much how my day went. Let's see. It's been a year. I thank God. Thank God for all the things I've learned, all the things I will continue to learn. Like I said, I think I mentioned earlier this morning, I'm getting ready to start learning how to do colposcopies. We actually, Nurse Practitioners Women's Health Association actually has a conference coming up at the end of this month that I would like to attend. I just emailed my HR person if that would be able to happen, because I need those days off, and also to see if the office would pay for that. So we'll see how that goes. I would love to be able to attend and just to gain a whole lot of information, especially in areas like hormones, menopause, the things that I'm doing that I'm not too familiar with, like on a personal level. I would love to get more knowledge base with menopause and things like that. But thanks for watching this video. Thanks for everybody who's been supporting the journey, and who knows, maybe I'll be your provider one day. Subscribe to my channel. I will get on here and try to be more consistent with videos. But I mean, go back and look at all my other videos, see how my journey went. I do have a lot of good information and study tips when it comes to taking the test. So you can also comment on this video and tell me what other things you would like to hear or find out from me. But yeah, thanks for tuning in.